Hey everybody, welcome to tonight's webinar. Thank you for joining me. I hope you're going to get some really good information tonight. We're going to spend maybe 30 or 40 minutes talking about a really important topic to you guys as pet owners. And that is basically how to make sure your pet lives the length of time that it naturally could do. And the time that it has is better quality, so it's happier, it's more energetic, and this goes for cats and dogs equally. Okay, so the cool thing about trying to achieve this is that if you do the things that we're going to talk about in this webinar, there's not only the benefits of your pet living a longer and healthier life, but actually you're probably going to have to visit the vets a whole lot less. Okay. And I don't know that there would be too many people too upset if that had to be the outcome of this webinar. So let's crack on. I'm going to go through a few things. Before we do that, I just wanted to introduce you to myself. Basically, I'm a veterinary surgeon. I've been a veterinary surgeon for over 15 years, over 16 years now. I graduated in Glasgow University, back in Scotland. I worked in London for about 10 years now as a senior vet in an 18-doctor hospital. I came out to Sydney and I came out here for 12 months, and that was about 5 years ago. So safe to say that I'm very much enjoying my time in Sydney and loving Australia. So I guess you could say I'm something of a pet health expert. My practice, I own two hospitals. They're called Dr. Day's Vets and Pets. One is across in North Ryde, the other is across in Darlinghurst. But the purpose of this webinar is not to talk about me or to talk about the hospitals. It's to give you really solid information so you can help your pet be happy and healthy. And that really is what Dr. Day's Vets and Pets is all about. So let's crack on. We're going to cover 10 things that basically they're almost like 10. Think of these as wellness points. Things that if you do them right, your pet's going to live longer. If you do them wrong, there's a pretty good chance your pet's going to live a shorter life than would otherwise have been possible. Okay, so we'll cover the 10 things that you guys need to know to keep your pet as fit and happy and healthy as possible, and also the actions you can take now to help your pet live. And this is on average 2 or 3 years longer. Isn't that crazy? I mean, if you do these simple things, or like most people, if you don't do these things, your pet is going to die 2 or 3 years younger than it would have done. Okay, that's insane if you ask me. That blows my mind that we can get this much extra time with our loved ones just by making some simple lifestyle changes. Okay, and if all of that information wasn't good enough, and it's going to be pretty practical stuff we're talking about, then I do have a little free gift for you as a thank you for coming on this webinar this evening as well. So we'll get to that in the end. Our runtime's probably going to be 30 or 40 minutes, and so we won't keep you for too long. Okay, so let's just smash on straight into these. And the first health tip is vaccinating your pets saves lives. Now, you may think, wow, that's kind of obvious, isn't it? And to me, actually, all of these things are kind of obvious. But, the reality is that after that sort of second, maybe third year vaccination, basically after the puppy vaccines are done and that first year booster is done, the vaccination rates for dogs and cats, actually it's a little lower in cats because they're a little harder to get into the vet, but the vaccination rate falls in half. Okay, which means that 1 out of every 2 pets out there is not vaccinated, i.e. they're wide open to diseases like parvovirus, distemper, hepatitis, kennel cough, all sorts of very, very serious and life-threatening illnesses. And people say, well, we don't see too much in the way of, parvovirus anymore. And to a degree that's true, but it's certainly out there. And one of the things about parvovirus is that it's a very, like this or not, it's just the way it is, but it's a very socioeconomic disease. So in suburbs where there is more wealth and more pets tend to be vaccinated, there tends to be an awful lot less parvovirus or almost no parvovirus. In suburbs where there is no vaccination, there tends to be a much, much higher incidence um, of parvovirus. Now, just because we don't see it very often, I'm telling you right now, it does not mean it's gone. And if everybody stopped vaccinating, then we would see a resurgence of this killer disease that literally there used to be queues out of veterinary surgeons' doors to treat these dogs. And with a 50% mortality rate with parvovirus, that is extremely bad news. Now, one of the things that's been controversial is whether or not vaccines are actually good or not, okay? And this I just want to touch on briefly and just say there is no scientific debate at all about the effectiveness or safety of vaccinations. The only debate you will see is debate being generated by sensationalist media stories aimed to sell you not wellness, not your health, but a newspaper. So there is no debate in the scientific community at all that vaccinations are absolutely, to not do them is insane. And there's no doubt they've saved more lives across planet Earth than anything else. And if you want a sneaky, terrifying glimpse of what a world without vaccination looks like, then just think about the recent Ebola virus outbreaks in Africa and the potential spread of that is a potential nightmare scenario. Same with bird flu or SARS, because we just don't have effective vaccinations against these diseases. We become complacent because we just don't see the diseases very much anymore. So we assume everything's okay, and perhaps the newspapers are right, and we don't need to vaccinate. We can save ourselves $50 a year. Well, look, that's daft. It's going to cost you a lot more than that if your pet gets parvovirus. So, I hope the message is loud and clear. Vaccinations are extremely safe. They're not 100% safe, but they are extremely safe. They are extremely effective. And without them, we would have a whole lot more disease occurring and problems occurring. So that's health tip number one. Do vaccinate your pets. Number two, if your pet shows any of these emergency symptoms, call the vet ASAP. Okay. Now, I recorded another webinar a couple of days ago. It's going to come out soon, which is called Pet ER. And basically, it's a list of the 11 conditions that are really bad news for your pet if they occur and you have to act super quickly. Now, the crux of this problem is act quickly. And I could summarize this point in one easy move, and that is if your pet's doing something weird, get it to the vet. Okay, don't Dr. Google things where your pet's just behaving really peculiarly. Dr. Google is not your friend in that instance. There's a ton of information out there. The problem with Dr. Google is you don't know who's the author and you don't know what's good information and what's not. And even if you did, then let's say your dog or cat ate, so your dog ate chocolate or your cat ate Easter lilies, okay, or stargazer lilies or something like that. You can go online, you can search. The trouble is, by the time you'd find out the information you worked out as a problem, you've passed that golden sort of half an hour, 45 minutes where stuff's being absorbed into your pet system. That's the point at which we can really have a big impact. So that sort of underlines the point that if your pet does something weird, so if you suspect it's been poisoned, if it collapses and won't move, if something looks broken, if your pet has breathing issues, if there's acute bleeding, or even if there's chronic repeated bouts of bleeding happening from anywhere in your pet's body, that needs to be seen immediately. Swollen stomachs in dogs, they're always bad news as well. So basically, you're looking for bleeding, you're looking for collapsing, you're looking for swelling up of bits of the body, things that don't appear to be working, or any suspicion of ingestion of a toxin. They're all things that you've got to get straight in there and get attention quickly. Okay, I put this in as health tip number two because I've seen so many animals that I could have saved if only I'd seen them an hour or two earlier. So think of that as the golden time that you've got is that first half an hour to 45 minutes. And unless you're in a very rural part of Australia, then there's going to be an emergency. Either we're going to be open, or your own vet's going to be open, or your emergency centre after hours is going to be open. But it really pays to know, have these numbers on speed dial, have the maps programmed in your sat nav, so there's just no wasting time or getting lost. There's nothing more frustrating than when there's a pet that's got a problem and you can't find your way to the surgery. And I had exactly what a case like that with a dog called Wilco back in the UK. And Wilco seriously cut like a massive cut across the back of his paw and was bleeding to death through this cut. And my client was maybe two minutes from our main hospital, and she didn't know where it was exactly. So she had to drive back to the branch surgery through traffic in London, which cost her another half an hour. And by the time Wilco came in to see me, he was sheet white, like literally like a ghost. And I thought, oh my goodness me, we're going to lose him here now. We didn't. We managed to get him back, but if she'd have known where to go in the first instance, then he wouldn't have been as critical a case, and he probably wouldn't have needed blood transfusions and a protracted stay in hospital. As it was, he was okay, but it could have ended very badly. So, okay, so that's health tip number 2. Now, one of my personal favorites and pet peeves is do not feed your pet bones. Again, we're kind of in this webinar, we're talking a lot about avoidable things that you can do to stop the bad stuff happening. And this definitely counts as that. It just amazes me how many people here in Australia feed bones. And it's only here in Australia that is a common occurrence. In the US, it's not. In the UK, it's not. Indeed, AVMA, the American Veterinary Medical Association, even have a position statement on why feeding bones is a dumb play. Okay, now we don't need a position statement. I'm happy to show anybody that wants to see this series of X-rays of bones being stuck in weird and particularly bad places in dogs and in cats that I've had to deal with in the surgery. Animals that without surgical intervention would have died, and in a couple of very sad cases, despite surgical intervention, did die. So this X-ray you can see on your screen with the big red arrows pointed in the middle of it, that whitish sort of blob you see between those 4 arrows is actually the top of a lamb shank. And this was an old West Highland White Terrier that ate that, and it got lodged in its esophagus. And if that had done some serious damage, like torn his esophagus, there wouldn't have been anything that the best surgical team could on this earth could have done for that pet. As it was, we got lucky. We could push that down into his stomach, and the dog made a full recovery. But again, it's a preventable thing. Now, I know why people feed bones. You feed bones because you want, the dogs like it, cats like it. But people also feed them because they think they clean their teeth, and that's not true. They break teeth. Dentistry is a massive part of our caseload. As Sydney's pet dentists, we see a lot of dental disease every single day. And guess what? We see dogs with fractured teeth because they chewed on bones every single day. Again, completely and utterly avoidable. So feeding bones, you're just running, there's 3 lotteries. Number 1, they're raw and they're going to be covered in bacteria. And if your dog goes out and buries them in the yard and it's 30 degrees out there, then digs them up a couple of weeks later, and then gets an upset tummy, gets a bout of gastroenteritis, well, go figure. How could that possibly happen? It stands to reason that's not a good health tip. The second thing is they break teeth, and the third thing, and the most serious thing, is they obstruct in places. So if you want to avoid the dentist and you want to avoid the surgeon's knife, then I would suggest stay the heck away from bones for your pets, and I think you'll be in better shape for it. Now, there are healthy, safe alternatives to giving bones that will keep your pets occupied. We've not got time to cover that today, but there are some fantastic toys out there that are very, very safe, will keep your pets completely engaged, and don't carry any of the risks. So stay away from the bones. Okay, let's keep going. So my health tip number 4, and some of these tips kind of tie together because the body systems, their pets systems are all kind of interlinked. And this is a funny photo, isn't it? It looks like there's a two-headed, one-bodied, six-legged dog there. But there are two dogs just crazy charging around on the beach. And, even in that photo, you can see those animals are in good trim. They're not overweight. Now, here's the scary stat. About 40 to 50% of our pets in Australia are now not just overweight, but clinically obese. Okay. So taking regular exercise is an awesome thing for several reasons. Number one, and again, I've used this photo with good purpose. One of those dogs is probably some kind of cattle dog cross, and the other one's a retriever Labrador. Okay, both dogs are working dogs. Again, I meet lots of people with working dogs who go out to work for 9 hours of a day, come back in, and they're a little bit surprised that their dog trashed the sofa, or their back door is a pile of matchsticks when they get in, or there's a hole in the in the kitchen floor. And I always think, well, wow, how is it that you're surprised by that? Because these guys are intelligent, they're bright, they're engaged pets, animals, and they're bred to do some pretty high intensity stuff like retrieving or herding sheep or stuff like that. So then we put them in a sort of city unit without much of a garden. We don't take them to work, and we wonder why, when they get bored, they do bad things. So regular exercise, and for a lot of dogs, that can mean like a couple of hours a day or more. But it also means mental exercise. And again, this comes back to one of the reasons people feed bones is because dogs like it and it keeps them occupied. So it also means making sure we enrich the environments of our pets so they don't feel compelled to go out and trash things that chew up our best pairs of shoes. That they've got ways and ways of discharging that energy that include mental and physical exercise. And that will not only help keep your pet in good trim, which is like just so important for overall health, but it will stop your pet, and this is a big one, particularly in young animals. Lots of people, and I'm not saying you do this, because I suspect the people that come on webinars like this are very unlikely to ever take their dog and dump them at the pound. But the number one reason young dogs are euthanized in pounds across Australia and across the world, in fact, is because they were destructive animals, because they were bored and they were just dumped. Okay. And it's if you can give them regular physical and mental exercise, then that's just not going to be an issue for you. So health tip number 4 is get exercise with them. It's good for you as well, but make sure you have this balance between the mental and the physical exercise, and I think you'll find that they really, really benefit from that. Okay, so health tip number 5. Deal with small problems before they get to be big problems, okay? Now, this is quite distinct from the emergency thing, okay? Because, there are just a bajillion different ways your pet can get sick, okay? And even as vets, it's sometimes hard for us to keep up with all the different things that can be going on with an animal. So I don't expect you to know or notice every single little thing. And I don't think you should be jumping in the car and, speeding up to the vet every time your dog has an itch, okay? We're not here to just, the purpose of this webinar is actually to try and help you stay away from the vet, believe it or not. But too many people don't deal with things when they're small things, okay? So let me give you a great example of that. Again, with dental disease. When your pet has a small amount of tartar, that's the same calculus that builds up on our teeth, they get it too. When your pet has a little bit of that, get that cleaned off when it is a small amount, okay? Because if you leave it, then we know what happens there. It builds up and it builds up and it gets worse and it gets worse and it gets worse to the point where eventually your pet's got abscesses, rotten loose teeth, and it needs this massive, massive dental. Now, that's a disaster. And we'll talk more about that in one of our other tips a bit later on. But the point is, it was preventable, and a small amount of work done when the problem first showed up would have stopped a big problem happening down the track. Okay, so if you're seeing something that's bothering you with your pet, definitely get that checked out. We do a lot of wellness blood testing in the clinic, and if we find an abnormality in the point of doing those wellness blood tests and urine tests are that if you find something on them, then you just probably got a 2 or 3 year head start on the problem becoming clinically apparent to you. Okay, so a great example would be cats with kidney disease. By the time your cat starts drinking and losing weight and doing the things that make pet owners bring them to the vets, they're down to their last 25% of functional kidney tissue. Now, you can pick that sort of thing up with a blood test miles in advance, then you're probably going to get another 2 years in addition to what you would have normally gotten for a cat with kidney disease. It's that sort of reward that you're going to get by dealing with little problems when they're just little problems. So your dog has a little lump on its side. Get it checked whilst it's little. Again, I see so many people that, maybe they saw someone and said, hey, it's not a problem just yet, keep an eye on it and see what happens. And you know what? You're seeing a lump every day, and it's kind of hard to notice. Is it getting bigger or is it not getting bigger? And then you go back for your annual checkup next year or 2 years' time, and boom, guess what? The thing's now 4 times the size, and it's bad news. Well, there's so much less we can do about that situation than if it was just dealt with, bam, when it was initially a problem. Okay, so little problems, nip them in the bud before they get to be big problems. Okay, health tip number 6. Honestly, guys, I think this one, and I have one more later about dental care. And I think if you're looking for out of this whole list, what the 2 things I should do, then get the right pet food for your pet and keep their teeth clean. And honest to goodness, if you just did those 2 things, then that is almost guaranteeing your pet to live a happy, healthy life. Now, I put this slide up with the sort of imbalance here because I just wanted to be able to sort of say that not all pet foods are created equal. There are good pet foods out there and there are bad pet foods out there. Now, I'm not going to name any brands right now because I don't want to get sued. But I can tell you certain brands of food from the supermarket that an animal is fed on by looking in its mouth, okay? Or by looking at its weight when it waddles in the door, okay? If we have a dog that's 3 years of age and its tummy's nearly touching the floor and its teeth are rotten already, then chances are that animal has been fed one of these sort of high fat, high sugar, mushy pet foods and has had no dental care. Okay. Chances are also that that animal's life has been shortened significantly even by that stage. All right. So there are a lot of philosophies or thoughts on what diets you should choose and what you shouldn't choose. Okay. Now, I personally like to keep stuff nice and simple. I'm a busy guy. I've got a lot of stuff on. I've got 2 pets of my own, and I spend so much time looking after everyone else's pets that I don't have a whole lot of time to go cooking my own diet. Actually, even cooking my own food, but particularly cooking food for my pets. And honestly, even with a veterinary degree and all the knowledge I have about pet nutrition, it still would be very hard to get it right. So I am very, very happy to delegate that responsibility to pet food companies I actually trust. Okay. Now, if you choose a food that's high in fats and sugars and salts, then your pet's going to get rotten teeth and going to be overweight. And they're the two things we really want to combat. Okay. So choose a good food. And personally, I think dry foods are going to be better off in terms of dental care and also in terms of financial impact on your bank balance than any canned food. Okay. But I am very, very happy to, there are some good pet food manufacturers out there. There's Hills, there's Royal Canin, there's Eukanuba. I think they're all excellent choices. And there are some bad ones out there, which I'm not saying absolutely all the other pet foods are out there, but your very well known, supposedly premium brands you'll find in supermarket shelves are often ones that we find animals coming in with problems. Okay. So I would think this is probably your most important decision that you're going to make every day. And a lot of people will just go with the price tag on a bag. And I think that is a sincerely bad way to choose the sort of food you go for. I mean, if you we are what we eat, right? So if you feed the supermarket special every day of your pet's life, then not necessarily is that going to be the best level of nutrition, and your pet's not likely to live as long fed that sort of thing as if you fed it a better one. And the best analogy I can give you is imagine eating McDonald's every day. Imagine what that does to your health over a number of years. And you kind of get the picture, right? So I would choose pet food wisely, and I feed my own pets Hills, and particularly I give them the dental biscuits because it comes back to don't let them get fat and keep their teeth clean, and the dental biscuits do a great job of both. So happy to make that recommendation to you all. Okay. And tip number 7 does kind of link in this. Now, it's kind of a little unfair to pugs, bless, that's quite a cute photo, isn't it? And I put that up there not because pugs are meant to be fat or they all end up fat. It's just a lot of them do end up really fat. And partly that's because they are like hungrier than Labradors. Like a pug is like a Labrador cubed in terms of how much it will actually eat. They will literally eat till they burst. Not joking. Um, so in terms of preventing obesity, well, let's start with a little why you should prevent obesity, and this is important. We learned recently some really interesting stuff about fat in not just animals but in us too. So let me talk about arthritis for a second, because that's traditionally with fat animals we think about them getting arthritis, but the truth is almost every single disease that our pets get is 10 times worse if they're fat. And I wouldn't really, this is just an observation. It's only recently we've kind of worked out why that was, because fat is not this inert, inactive substance in our body. It's actually an organ and does some really interesting things. Now, animals that have higher fat levels in their bodies have higher levels of inflammatory chemicals in their bloodstream, which means if you've got pain or inflammation somewhere else in your body, then that fat is making it worse. So animals that are arthritic, we always used to just think that they struggled with moving around because they were just mechanically carrying more weight and their joints just couldn't deal with it. But that's only partly true. The other part is their joints are just swollen and sore because of the action of the fat in their body. So now we know that if we get the weight off of them, it's just the most amazing thing that you can do, is to drop the weight, and you suddenly see these animals, they maybe only dropped a kilo, but suddenly they're moving better, they're interacting more, they're just starting to recover their love of life. And that's awesome to see. But it's better to prevent it in the first place. Okay, so how do you stop getting, well, how do most pets end up fat in the first place? Okay, well, number one, we kind of covered it in the last tip, poor diet selection. So if you choose bad food, then your pet's much more likely to end up overweight. But the second thing is portion control. And most people are not measuring out the correct amount of food for their pets. Now, again, if you're choosing a reputable super premium brand, then trust what it says on the side of the bag because it's accurate. And some people, particularly when I switch them over onto Hills, are like, "Oh my God, there's like no biscuits there, right?" Um, but there are. There's the calories are all perfectly formulated for what our pets need in our modern lifestyle, our modern environments in which they're in. So definitely watch the portion size, and that will help. And the third reason animals become overweight is we give them tidbits on top. Okay, one of the more common things I get when I ask my clients, what do you do for dental care? They almost always talk about these treats or chews that they give. Again, no manufacturer's names recommended. But the truth is, those things don't work. The only one thing that really works for dental hygiene is toothbrushing. The number two thing is a diet called TD by Hills. The number three thing is a product called Healthy Mouth. Beyond that, there's really nothing that works for keeping pets' teeth clean. Okay, so treats and tidbits that are sold to you on the basis of some other health benefit are really not doing the things you think they are, but what they are doing is massively adding to the amount of calories that your pets are getting. And that's one of the reasons why so many of our pets are overweight. And just think about, that small piece of liver, that like a liver treat, or that little biscuit you give them, it's kind of like the equivalent for us eating a burger after dinner, okay? Or a bag of fries, or a bag of potato crisps or something like that after dinner. So and most people give them two or three treats. Well, no wonder they end up the weight that they do. So in order to stop your pet getting overweight, feed a good quality food, feed the right amount of it, even if it looks like a small amount. If your pet stays too skinny, you can always put the biscuits up. It's easier to do it that way around, trust me. And really watch those treats and tidbits because they will put weight on really quickly. Now, your reward for having a pet that's the right weight is an animal that's going to be far more energetic, not develop like to the same degree. Just, I mean, the list of diseases that's made worse by being overweight or more at risk from being overweight is huge. Okay, we're talking bladder infections or bladder stones in cats. We're talking pancreatitis in cats and dogs. We're talking heart disease. We're talking arthritis. We're talking cancers. The list is just enormous. So this is huge. Just try and keep your pet trim. And it's so easy to know if your pet's trim. Like most veterinary practices would be more than happy to give you an opinion. And I don't know any vets would even charge you for that. I mean, the nurses can come out, pop your pet on the scales and give you some advice, on whether your pet's overweight or not. And if it's overweight, then heck yeah, it's worth paying for an appointment to see the vet and deal with that, because obesity is every much as bad a disease, and if not worse disease, than some of the other things we see in pets that people are perfectly happy to pay for. So make sure and keep this one under control. Okay, let's keep going. Stop the parasites. Now, particularly here in the east coast of Australia, this is so important. And there are 4 parasite groups that we need to deal with. Okay. Now, again, a lot of people think that they're dealing with parasites, but there are so many products out there available from so many different outlets that it's really hard to know if you are using products that are effective, using them at the correct doses or frequency of treatments, and that your pet's safe, because some of the products you can buy in supermarkets are actually pretty dangerous, particularly to cats. So what parasite groups do we actually need to deal with? Well, here's the 4 I break it down into. Okay, we don't need to go into fancy schmancy names, but we do need to deal with paralysis ticks. Fleas are the scourge of Sydney. Intestinal worms, not just to keep our pets safe, but to keep our families safe as well. And heartworm. Okay. Now, paralysis ticks and heartworm are the 2 big killers that we need to deal with. And fleas are probably the most prevalent, and intestinal worms are usually kind of an invisible menace, but they are there nonetheless. And intestinal worms can infect our kids as well. and cause bad things to happen there. So we must take care of all of these things. Now, the products that there are just so many of them out there, and I understand why people get so confused. But I meet people who've come in and they've doubled up on the flea thing, but they've not got any heartwormer happening. Or they've got the fleas and the intestinal worms and the heartworm covered, but they've not got any paralysis ticks protection in there. And so you can do a few things, but there's a couple of things I'd recommend to you. Number one, either have a once a year ProHeart injection that stops heartworm. And if you do that, then use a product called Advantix and use that every 2 weeks during tick season. So that's kind of from probably about September, October time, round till about April. And then you can back that treatment off to once a month. Now, the Advantix is going to take care of your paralysis ticks and your fleas. Your ProHeart injection took care of your heartworm. Then all that remains is every 3 months to give your pet a worming pill. And I'm very happy with Milbamax as a product. Drontal's also a very good product. Okay. Another alternative, and one I really like, is the combination of Advantix and Sentinel, because Sentinel attacks the flea life cycle in two different ways. In one way, but the Advantix kills your adult fleas. Your Sentinel attacks the life cycle a different spot, and that is by sterilizing the female fleas so their eggs don't hatch. Effectively, it's like the pill for fleas, okay? But Sentinel also contains a heartwormer and an intestinal wormer. So you've got your top two covered by using your Advantix. You've got your bottom two and then a little bit more flea protection by using your Sentinel. And I really like that. Sentinel's to be given monthly, okay? But whatever you do, you should get veterinary advice on this. And, you know, one of the reasons we see animals coming in so often that don't have the right protection, or worse still, have actually succumbed to a paralysis tick, is that the people they got the advice from were, with the best will in the world, school kids on supermarket checkouts or in a pet store. Okay, people who are just not qualified to sort of give you that sort of advice. And in America, by the way, the products we get over the counter here, they're all still on prescription, and that's the reason, because it's pretty complex and not all products are safe for all pets. Okay, now if you're a cat owner listening at the moment, let's just, before we move on, just tell you what we do with cats. Okay, now I divide cats down into two categories. We got what I like to call the bush rangers, so they're the outdoor cats that patrol outside of your garden. And then we got the couch potatoes, they're the indoor cats, or the cats that just have a very quick mooch around in the yard and don't go very far from the back door. Now, the difference between these two groups is that the bush rangers are going to be highly at risk of paralysis ticks. Okay, so we need to do something different for those guys. And so their protocol, we generally will recommend frontline spray every 3 weeks during tick season. And you can do that once a month when it's not tick season. But give them a Milbamax worming tablet every month, and that will deal with heartworm as well and your intestinal worms. So again, your frontline spray, and it's the spray, not the drops on the back of the neck. They deal with your paralysis ticks and fleas, and then your Milbamax is going to take care of the bottom two, your intestinal worms and heartworm. If your cat is the couch potato, then we use a different product. We use Advocate, because we're really not worried about paralysis ticks, and Paralysis Advocate does nothing, has no activity against paralysis ticks. But Advocate takes care of the other three groups, with the single exception of tapeworms. So we give a Milbamax every 6 months for tapeworms in those guys. Okay. Now, we have all of this information available on our website as well, or anytime you come in, or heck, you can just phone us up and we're happy to go through this sort of thing with you. But these are standard recommendations for us across both of the practices. Okay. One thing to note, we've mentioned a few products, and just bear in mind that Advantix is a dog-only product. It will kill cats if you apply it to your cat. So that's Advantix It must not be put on cats. Again, I think that's a good reason. This is why I think it's a good idea to have these conversations with fully trained professionals, and you'll find them in veterinary practices. Okay. Alrighty. Health tip number 9: brush your pet's teeth every day. What? You say? Every day? You must be nuts. Well, look, no, I'm not nuts, and these X-rays show you exactly why I'm not nuts. Okay. So look at the X-ray on the left. This is a relatively normal X-ray of a dog's mouth. Okay. And you can see sort of nice white bone. The teeth you can make out, and these are the bottom teeth in the jawbone, and they are all looking really nice. Okay, nice and healthy. Okay. Now, do a spot the difference contest on the other side. What do you see? And what you see are all of these big black lines, big gaps that have appeared halfway down the teeth. What's happened there is infection bacteria that are in all cats and dogs' mouths, but we're not getting brushed away every day, start to attack the gum line and have literally eaten the bone away. And so those big black gaps are just pockets of pus. This is an animal that would have been in agony. And note one thing, guys: animals do not stop eating and drinking when they've got mouths like this. They just stop chewing. They'll just swallow their food whole. Okay? So just because your pet's eating does not mean that it's not got this problem. Again, we've got a whole separate webinar that's available on the vetsandpets.com.au website homepage about dental disease. I would encourage you to go watch that one if you haven't done already. But the trick to preventing this is to brush your pet's teeth every day. Okay, and I know that sounds bananas, but it will make a huge difference to your pet's welfare at the end of the day. And you've got to be careful which products you use again for that, because there's some really hopeless pet toothpastes out there, and there's some hopeless pet toothbrushes out there, and you don't want anything fancy, but you've got to effectively brush the gum line just like we brush our own teeth every day. And please get your pet's teeth checked by a veterinary dental expert. In the practice, all of my guys I've personally trained them in veterinary dentistry. And so we assess an animal's mouth every time they come in for an examination with us. And every 6 months, it's a good idea just to come in and have that checkup done. And the dental checks at Vets and Pets are free of charge. Okay. So we're very happy just to give you an opinion and a heads up on where your pet's mouth is at. And if it's looking bad, then we'll tell you what we'd recommend to do to fix it. And if it's looking great, then we'll tell you and coach you on what you need to do to keep it that way, because prevention is so much better and cheaper than cure. Okay, so please brush your pet's teeth every day. And that, if you keep your pet's teeth clean and don't let them get fat, then boom, you have just got a pet that's going to be bomb-proof when it comes to the vets. Okay. All right, now de-sex your pet. I didn't want to put up any gory pictures or anything for you, and I thought, de-sexing, getting the snip, it's kind of, this picture made sense to me. So, but to leave an animal not de-sexed is literally like a time bomb waiting to happen. Okay. One of the coolest things about working here in Australia is most people do de-sex their pets way more than back in the UK. So worm infections are one of the big problems that I used to have to deal with back in the UK. You leave an animal undesexed, and the hormones, as time goes by, influence the uterus in the female, in the bitch or the queen. And as they get older, they develop a very high risk of getting an infection in there. And because the uterus is just this place that babies are meant to grow, or puppies or kittens are meant to grow, and the immune system's not supposed to get there, like bacteria just have a party, and they just end up with these big sacks of pus in their wombs, and eventually they're going to burst and poison them, and it's a grisly way to go. So desexing prevents that happening, prevents unwanted litters of puppies, and that's not just good for your pet, but it's good for all the animals that are born and euthanized across Australia every year, and there are hundreds of thousands of those. So desexing just makes a whole lot of sense. It reduces risks of certain cancers. It reduces aggressive behavior in cats. It stops roaming, and cats that roam tend to get in more fights, so they're going to need more trips to the vet. They're going to be at higher risk of getting feline AIDS virus that's spread primarily through fighting and sexual contact between cats. And they're also going to be more at risk of getting hit by cars because they're out roaming. So desexing actually has a pretty major impact on your pet's health. What it will not do is change your pet's character or behavior in any other way. Okay, guys, so those are my 10 tips for maintaining a happy, healthy life for you and your pet. I hope you enjoyed the presentation. That's kind of the end of it. We hit the 45 minutes absolutely on the nose, which is kind of cool. Thank you very much for joining me. And as a little extra thank you, I have an ebook which you're more than welcome to download. It's free of charge. Just go to vetsandpets.com.au/top5mistakes.php and you can get your free copy there. And that basically summarizes a lot of what I've talked about in this webinar and gives you good advice on how to keep your pet happy and healthy. And that's entirely our philosophy at the practice, is trying to teach you to do the things that mean you don't have to wind up going in and seeing the vet. Okay, so that brings the presentation to an end. If you do ever have any questions, feel free to email them in to me. My email is Dave, D-A-V-E, @vetsandpets.com.au. Always happy to receive your questions. And yeah, if there's anything we can do to help you or your pet, then look us up. You'll find the website at vetsandpets.com.au. And if you're local to Darlinghurst or North Ryde, we'd sure love to see you and your pets. So have a lovely evening and enjoy whatever you're doing, and look out for future webinars in the future. We do have an email newsletter you can sign up to, and we can keep you abreast as any of those things are coming up. So have a great evening, guys, and I hope to speak with you again really soon.